Kirtika Kuntal. I am a second year DM Cardiac Anesthesia resident at UN Mehta Institute of Cardiology and Research Center, Ahmedabad. I took admission last year through NEET SS 2024 with an All India rank of 71 and decided to come here as this is one of the most premier and an apex cardiac institute not only in the country but in all of Asia at the moment. Here we have a total of 6 cardiac cath labs, out of which one is a designated pediatric catheterization laboratory, offering us the advantage of an exposure of 10 to 15 pediatric cases per day, such as atrial and ventricular septal device closures, PDA stenting. We also have a state-of-the-art, well-equipped electrophysiological cardiac cath lab with advanced technologies such as 3D mapping, radio frequency, cryoablation, pacemakers. We have a total of 4 adult cardiac cath labs, out of which one is a hybrid cardiac cath lab, a very novel concept. If the patient has any emergency, he or she need not be shifted to the operation theatre, but an intervention can be performed in the cath lab itself, which is well equipped with an anesthesia workstation, high-end ventilators and a heart-lung machine. All of our cath labs are modular, which means they are well equipped with IVIS, OCT, Doppler, IABP and advanced systems. As an anesthetist, here I am responsible for offering sedation to both complex congenital cardiac cases as well as adult cases with good hands-on with transesophageal echocardiography as well as transthoracic echocardiography. We also offer general anesthesia to procedures such as EVAR, TVAR, TAVI, abdominal, lower limb and carotid conditions and all other forms of peripheral interventional vascular diseases. One of the remarkable hallmarks of our institution is that any patient presenting to the institute with an acute myocardial infarction will get treated right within the very first hour of his arrival at the hospital, which means we are involved in giving both emergency as well as acute critical cardiac care. We have an onus of working with a highly skilled and dedicated team of senior level cardiologists that work here in our cath labs on a 24/7 basis. Hence, I would recommend everyone to come here not only if they want to gain confidence in managing surgical conditions, but also in managing medical conditions and working in a comprehensive manner with the Department of Cardiology. Thank you.
Hi, I am Dr. Raj Mohan, DM Cardiac Anesthesia Resident from UN Mehta Cardiology and Research Institute. I would like to briefly talk about the hostel services provided for the residents. Here you will be given a single occupancy room which is very well furnished with a double cot bed, a wardrobe, a kitchen and vanity space, a table and chairs. The hostel is 24/7 under CCTV surveillance and security personnel will be available in each floor of the hostel, ensuring our safety. And the hostel does provide excellent amenities like lift services, parking services and housekeeping services and a separate gym for the residents. And the hostel will be connected with a bridge which will help your easy commute in your duty days. This will be resolved by UN Mehta control team within 24 hours, and the institute doesn't charge you anything for your hostel services and other services. Overall, the hostel does provide you a comfortable, safe and supportive environment so that you can focus on your career and academics. Thank you.
Hi, I am Dr. Kriti Patel. I am from Bhopal. I am doing my first year residency in DM Cardiac Anesthesia here in UN Mehta. Talking about the OT complex here, we have around 12 to 15 modular OTs in A block. All the OTs are well equipped with latest anesthesia machines and all the instruments. Here we are doing almost all types of adult and pediatric cases. Out of all the OTs, 8 to 10 are adult OTs and rest are for pediatric cases. On an average, we are doing around 20 to 25 adult cases and 5 to 10 pediatric cases. In adult cases, we are doing CABG, valvular diseases cases, vascular surgeries of aorta and peripheral vascular disease surgeries. We are also conducting lung surgeries such as decortication, lobectomy, etc. Our surgeons are well versed with performing almost all types of surgeries in open as well as in minimally invasive techniques. We have a separate robotic OT also So as anesthesiologists, we get a great exposure of one lung ventilation management here on very regular basis. We perform one lung ventilation using both double lumen tubes as well as bronchial blockers. We have a separate team for transplant anesthesia and transplant surgeries also. We have conducted almost 50 plus transplant cases as of now. Coming to pediatric cases, we are doing simple as well as complex cardiac anesthesia, complex congenital cardiac surgeries, which is very unusual in normal cardiac centers. We have minor OTs in B block also. These OTs are used for emergency minor surgeries, such as we have minor OTs in B block also. These OTs are used for minor emergency surgeries such as embolectomy, bronchoscopies, LSCS of all types of heart disease pregnancies. So as cardiac anesthesiologists, we get a great variety of surgeries and great exposure of cases here, and we get to improve our skills in invasive lines such as central line, arterial line, IABP, pulmonary artery catheterization, etc. So as we all know, TEE is the main armament of cardiac anesthesiologist. Here we get great hands-on on TEE under the guidance of well-experienced consultants both in operation theatres as well as in ICU. Thank you.
Good morning, I am Dr. Aarti. I am a first year resident in the Department of Cardiac Anesthesia at UN Mehta. UN Mehta is one of the apex cardiac institutes in the country. We have multiple ICUs with well-trained staff and adequate equipment that enables excellent patient care. Our top priority is patient care and decreasing any delay to patient treatment. We have access to IABP, ECMO and renal replacement therapy as well. With regard to our post-operative ICUs, we have 60-bedded adult post-operative ICU, pediatric cardiac ICU and step-down ICU as well. Besides all this, we have a hybrid ICU which is one of the initial points of contact for the patient, in which we have members of all three departments, that is cardiology, CVTS and cardiac anesthesia, working in tandem in order to give the best patient outcome possible. So with all of this, residents have exemplary exposure to a wide variety of cases, and thus we can own our skills and develop our skills in ultrasound, TE and invasive lines. So with all of this, I can say that UN Mehta is a good option for entry because we have an overall comprehensive approach to patient management.
Hi, I am Dr. Dinesh Kumar, cardiac anesthesia resident from UN Mehta Institute of Cardiology and Research Center. Library provided with every 24 hours we also provided with extensive collection of journals, international and national author books, and there will be classes in every week, like 3 days, Tuesday, Thursday and Saturday, in seminar, case presentation and journal club, where you gain your knowledge and fundamental skills from faculties. And there is a library is 24/7, and you can get access internet journals available. You are provided with One Nation and One subscription and MyLaft and various online platforms. Thereby it will be helpful in your dissertation work and gaining the knowledge. As you know better, you will do better. In UN Mehta, we are also run refresher courses every year. Faculties across the India will come. There you can gain your knowledge and clear your doubts, and you can gain various amount of knowledges. And here in UN Mehta, we also run a program with interdepartmental seminar program, and thereby you can clear your doubts in various aspects. The seminar is conducted with cardiology department, cardiac anesthesia department and cardiovascular surgery department, so you can clear every doubts we are running. And there is also cath meeting. See every new cases, it will be discussed. You will gain every advanced things. You will gain knowledge in every advanced things, and you want, if it is not there also, you will get and then you can take a book to your room and read. You can come here and sit and read it. See AC room. You can. It is 24/7.